Good morning, everyone. Thank you for joining us. We will be granting permission to record one by one, so we appreciate your patience after you ask us for permission to record. I'm Erica Hartquist, Public Health Division Communication Officer with the Oregon Health Authority. Today, we are providing our monthly update on COVID-19 as well as RSV and influenza activity in the state of Oregon. And joining us today is Dr. Dean Sidelinger, State Health Officer and State Epidemiologist. This is an opportunity for you, members of the media, to ask your questions and hear from our experts. And in announcing this media briefing today, we have provided a YouTube link for the public to watch on OHA's YouTube channel. So a friendly reminder to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. And also another reminder to please remember to speak slowly, which helps the ASL interpreters. Okay, let's get started. Dr. Sidelinger.
Thank you, Erica. Good morning. I'm Dr. Dean Sidelinger, Health Officer and State Epidemiologist with the Oregon Health Authority. Thank you for joining us today. We are now well into the new year, with spring rapidly approaching, and I'm happy to report there's reason for optimism in the months ahead. Overall, respiratory virus hospitalizations in Oregon have decreased significantly, and influenza and RSV spread in our communities continues to decrease, which means even fewer hospitalizations are expected in the coming weeks. We are keeping an eye on a recent uptick in COVID-19 activity, and we remain alert to the possibility of a second influenza wave driven by influenza B. Let me give an update on the masking requirement for healthcare settings. As you know, when we decided to lift the mask requirement for public indoor settings in schools on March 19th, 2022, as hospitalizations decreased and more people in Oregon stepped up to get vaccinated and boosted, we kept in place the mask requirement for healthcare settings to protect workers and the people they care for. This requirement for healthcare settings covered those who work in any place where healthcare is delivered: hospitals, long-term care facilities, mobile clinics, ambulances, outpatient facilities, dental offices, urgent care centers, counseling offices, school-based health centers, complementary and alternative medicine locations, and others. Exceptions were healthcare facilities or medical offices where no healthcare is delivered and no patients are allowed, or areas that are physically separated from patient care areas. Members of our healthcare workforce have been on the front lines of Oregon's response to the COVID-19 pandemic throughout this public health emergency. They have weathered Delta and Omicron surges. They and people in their care needed the added protection of masks, which have proven themselves over the course of the pandemic to be highly effective means of reducing virus transmission, not only of COVID-19, but other respiratory viruses, including influenza and RSV. But we recognize that we are entering yet another important, more sustainable phase of the pandemic. Even as we monitor for temporary increases in COVID-19 and influenza B activity in the coming weeks, overall hospitalizations are expected to continue trending downward. And 86.6% of people 18 and older in Oregon have received at least one dose of the COVID-19 vaccine, while 24.5% have also gotten the bivalent booster. If these trends continue, we anticipate being able to safely lift the healthcare masking requirement over the coming months. Thank you to all the healthcare providers who continue working so hard to provide care for us as we need it. But we are still operating under an emergency because of the hospitalizations for patients with respiratory diseases. This allows our healthcare partners additional flexibility to care for patients that show up for needed care. Any change to the healthcare masking requirement must be made carefully in consultation with our healthcare and local public health partners and our senior health advisors in the Oregon Health Authority and leaders. As we move forward through this new phase of the pandemic, please know we are re-examining all pandemic-related policies in place, including masking in healthcare settings, and we'll be sharing additional information as it becomes available. Now, let me run through the numbers. RSV activity has dropped significantly since its peak during the week ending November 19th, when more than 25% of the RSV tests were positive, and the RSV hospitalization rate in children reached 13 per 100,000. RSV test positivity is now at 5.2%, and we're seeing just under 2 hospitalizations per 100,000 children. RSV continues to circulate and may continue causing a handful of illnesses through early spring, but we are close to the end of RSV season. As I shared earlier, we have seen a recent slight rise in influenza activity driven by influenza B virus. We do often see increases in influenza B late in the flu season as cases of the seasonally predominant influenza A virus decrease, leaving flu B to essentially fill the void. This is why we continue to remind people, especially parents of young children, that it's not too late to get a flu shot, as influenza B tends to cause more severe illness in children and young adults. During the 2022-2023 season, we experienced the earliest seasonal peak of influenza since the H1N1 pandemic in 2009. Not surprisingly, we have also seen the earliest plunge in flu activity in that time. Influenza test positivity peaked at 32.3% in early December and is now at 0.8%. By comparison, the peak of the 2017-2018 season wasn't reached until mid-March, and test positivity didn't drop below 5% until the end of April. This tracks closely with what's happening across the country, as seasonal influenza activity continues to decline nationwide, and the proportion of laboratory specimens testing positive for influenza declined for the 7th consecutive week. COVID-19 test positivity has increased in the last 2 weeks. However, COVID-19 related hospitalizations have been stable, following a steady decline since late December. We believe that the XBB.1.5 Omicron subvariant is now predominant here in Oregon and is likely the cause of our recent increase in test positivity. We do not know if this will lead to increasing hospitalization. Modeling from the Centers for Disease Control and Prevention predicts that COVID-19 hospitalizations will remain flat during the month of February. Overall, hospital admissions for respiratory illnesses have declined dramatically since early December. However, hospitals remain at or near capacity as large numbers of people continue seeking care for all types of medical conditions. As conditions continue to improve in Oregon, and as our state and the rest of the country finally begin the formal wind down of the pandemic response after more than 3 years, we are seeing more positive changes that speak to the normalization and manageability of COVID-19 in our lives. For example, on February 1st, the U.S. Food and Drug Administration, or FDA, removed the requirement for a positive COVID-19 test result prior to prescribing the antiviral medications Paxlovid and Lagevrio, which reduced the risk of severe COVID-19 infection in individuals at increased risk. This change acknowledges the limited accuracy of COVID-19 tests and allows providers or prescribers to consider symptoms and exposure history when diagnosing and treating COVID-19 infection. This ensures anyone with risk factors for severe disease, such as people 50 and older, those with underlying medical conditions, those who are under or unvaccinated, and individuals from communities of color and tribal communities can more easily access potentially life-saving antivirals. In addition, OHA and CDC guidance empowers individuals at risk for severe illness to prepare for COVID-19 exposure and possible infection, using tools, information, and action steps to protect themselves and their family. The recommendations in the guidance are simple. Know your risk. Talk to your healthcare provider about whether your age, vaccination status, or medical condition makes you more susceptible to severe illness. Make a plan. Think about how you'll protect yourself and those around you if you become ill with COVID-19 or your community's transmission level changes. And take action when needed. Get tested if you have symptoms. If you test positive, contact your healthcare provider for treatment or consider telehealth options. Let those around you know they may have been exposed. Isolate at home for at least 5 days. Wear a high-quality mask at least 10 days following your diagnosis and monitor your symptoms. And give yourself a leg up on reducing your risk of infection by getting the COVID-19 vaccine and booster. Thank you to everyone who has already stepped up and received their booster and their flu shot. Now, I'd like to briefly touch base on where we are with Mpox. We continue to monitor Mpox activity in Oregon. We are still seeing a small number of Mpox cases a month, typically 1 to 2, and often none. And we expect this to continue for the foreseeable future as we settle into an endemic phase of the outbreak. We are working closely with local public health, the healthcare, and community partners to get the word out about the importance and availability of JYNNEOS vaccine and to promote vaccination events as they become available. The total number of Mpox cases in Oregon now stands at 270, with cases reported in 12 counties since this outbreak began in June of 2022. In closing, I want to say thank you to my colleagues in public health, our federal partners, my coworkers at the state, local public health staff, tribal public health partners, and our community partners who continue working to confront all the challenges put before us. You continue to make a difference. Thank you. To those still impacted by the diseases I discussed, my thoughts are with you. Too many Oregonians are still getting sick, battling long-term symptoms, caring for family members, or mourning the loss of a loved one. But spring is almost upon us, and I hope everyone looks forward to this season of renewal as an opportunity to reinvigorate those prevention steps that have proven themselves over the last 3 years and ensure we and our families, friends, and neighbors stay healthy during 2023. With that, I'm happy to take your questions. Erica?
Thank you, Dr. Sidelinger. Our first question comes from Jake Thomas with the Lund Report. Go ahead, Jake.
Yeah, thanks for taking my question. So I'm wondering, with the end of the federal pandemic emergency provisions, it's my understanding that people are going to have to pay money. They might end up having to pay money to get vaccines and boosters. Is OHA worried that that's going to mean fewer people are going to get vaccines or boosters?
Thank you for that question. Let me start by saying that the end of the federal public health emergency is not a single date or a single act. There are multiple acts and requirements put in place that expire at different dates. And I think we are worried that we could see an impact on people seeking vaccination or seeking treatment during this time. But things are not going to change soon and are not going to change overnight in terms of access. The federal government has purchased a large number of vaccines and therapeutics that are available to individuals free of charge, and that won't change in the short term. There will be a time when those will have to be purchased on the commercial market, but that is still a ways off. Vaccines for individuals covered by Medicaid or Medicare are going to continue to be offered without a copay. For individuals with private insurance, they may have to start checking whether they're going to a provider who's in their network to see if those vaccines are covered and may not have quite as wide availability of vaccines. But many providers across Oregon, pediatric providers as well as adult providers, our pharmacists, will continue to offer vaccines. There will continue to be community vaccination events that will occur. They aren't occurring at the same level they were a year ago or 2 years ago, but that's because the demand has reduced. So I anticipate people will still be able to find that vaccine, but it may take an additional call or a check of their insurance company's website. For those who are uninsured, community vaccination events or community health centers are a great place to get a vaccine at no cost or reduced cost based on a sliding scale. Therapeutics, again, are available through the federally purchased stockpile and are available to individuals. Seeking care in network for those with insurance may minimize out-of-pocket expense, and a telehealth option for Oregonians who don't have a relationship with a primary care provider is still available for those who test positive or who are exposed and have symptoms of COVID-19 so that they can get access to the therapeutics if they're at higher risk. So systems will remain in place even as the federal declaration of emergency goes down, and we will continue to monitor folks' access and ability to get these treatments and see if we need to change course.
Thank you for that question, Jake. Our next question comes from Shayla with the Democrat Herald. Go ahead, Shayla.
Hi, I'm not sure if you can hear me very well. I have a similar question, given the federal emergency declarations ending. I'm wondering what that's going to look like for testing access, and if there's going to be any initiatives to kind of bridge that access if it will be more difficult.
Thank you for that question. Certainly, as part of the some of the regulations that are in place right now, have availability to not just vaccines and therapeutics, but testing as well, available at no cost for those with federal insurance, and requires private insurers to provide that testing. What individuals can do now before that emergency ends is to purchase or to go and get the available home tests if their family doesn't have any at home. Insurers provide up to 8 tests per month for individuals, and so you can purchase those tests to have some available at home as we transition to a phase where there may be a copay or a cost-sharing part of testing availability. If you have symptoms and you're sick and you're worried about your symptoms, you can contact your healthcare provider and may be able to get testing through your healthcare provider at no cost or with a small copay or cost sharing, depending on your insurance. But right now, testing is available widely, both in healthcare settings as well as home test availability through retail settings, and using your benefits that are currently still in place to purchase some testing to get you through the next couple of months is certainly an option and can reduce the cost later on.
Thank you for that question, Shayla. Our next question comes from Ashley with KGW. Go ahead, Ashley.
Hi, thank you so much. I was just curious if OHA has heard of any other stomach virus cases similar to what's happening in the Tigard School District, where a school was shut down. Have you heard of that happening at any other districts in the area, or any messages to parents at this time?
Thank you for that question. I don't have any information specifically on stomach viruses or gastroenteritis going on, but typically in the winter, we see increased circulation of infections, often caused by viruses that cause gastroenteritis. This is typically stomach aches, some vomiting and diarrhea, fairly common, especially in young children who aren't as good at hand hygiene. And so it's not unusual for us to see cases and outbreaks associated with childcare or school settings. And those can impact so many students and staff in those settings that the facilities do need to shut down for short periods of time while people recover. So some great things to do is, if you're a parent and your child has symptoms of gastroenteritis, diarrhea, is throwing up, or has a fever, keep them home while they recover. If you're worried about their symptoms, contact their healthcare provider about what else you can do. Washing your hands well, using an alcohol-based hand sanitizer is really important. And washing, if anyone is sick in the home or sick in a childcare or school setting, cleaning commonly touched surfaces fairly frequently is another setting that can reduce the spread of these viruses. Unfortunately, each winter we see these viruses come back. We do see impacts, and it can be hard to have a sick child at home, but better to have them at home and care for them than to have them at school where they could spread the virus to others.
Thank you for that question, Ashley. Our next question comes from Fedor with the Oregonian. Go ahead, Fedor.
Hi, Dr. Sidelinger. Thank you for taking my question. I wanted to ask about the healthcare settings mask requirement. So you said that if these trends continue, we may be able to safely lift the healthcare masking requirement over the coming months. Can you please be like as specific as you can so that we understand exactly what that means? Like, what specific trends and what numbers are we looking at, and what time frame?
Thank you for that question. Let me reiterate, in the fall, we said that we'd be looking at data that would indicate trends that would be safe to remove the masking requirement in healthcare settings once we got through the winter respiratory surge that we typically see, driven by RSV and influenza, and in the past couple of years, the addition of COVID-19. We don't yet know if COVID-19 is seasonal, but we have seen large peaks through the winter, and we anticipate that that will go down in the spring. Our healthcare partners, particularly our hospitals, have been overwhelmed by patients seeking care for respiratory illnesses through the fall and the early part of the winter. We still have a state declaration of emergency to provide flexible staffing to ease licenses for out-of-state practitioners as well as retired practitioners to provide the needed care for people who show up to hospitals right now. So while the numbers of people hospitalized for respiratory diseases are down, they're still at fairly high levels and people are seeking care for other illnesses. Our healthcare partners are relying even more on staffing agencies to provide care that their staff is unable to fulfill, right now. So that's the context that we're in right now. When we look at the trends that we can typically see, RSV typically doesn't have 2 surges in a year. So we think we're well past our surge for RSV. Influenza, particularly in seasons where we see an early peak, we sometimes see a later peak. So we're watching really carefully as cases have come up slightly, and we're seeing influenza B in that. COVID-19 cases, again, they've ticked up slightly when we look at percent positivity in wastewater, but our hospitalizations have remained stable. We hope that in monitoring those trends over the next couple of weeks and in looking at what our staffing is like in hospitals and the current declaration of emergency on the state level, that we'll be able to provide some criteria that we would be looking at, that we would say that healthcare requirements for masking would go away and individual systems and providers will make that decision. I can't give you an exact date when we'll give you that information, but I anticipate in the next week or two, and that masking requirement will likely go away in the next couple of months.
Okay, and if I could ask a follow-up just to help understand that, like, can you tell me about a realistic or plausible scenario that you're examining that would be one in which you would not lift the masking requirement in the next couple of months?
I would say if we saw a large surge in cases of influenza due to influenza B that was causing increased hospitalizations, that our hospitals needed additional resources to deal with, that would impact our decision. The current declaration of emergency supporting these measures in hospitals goes through March 31st, and I would anticipate with the current trends that we would not see that continue. Each year, we monitor RSV, particularly by looking at percent positivity to determine when some of the youngest babies who are born, premature babies who are born each year before the RSV season, receive a preventive medicine. We monitor that percent positivity to determine when we start giving that medicine. And as that comes down, we can stop giving that monthly injection. So we would probably look at a data point like that, a percent positivity for RSV. In the Tri-County area each year before the pandemic, public health and our healthcare partners used percent positivity for influenza as part of our surveillance system to determine when to limit visitation in hospitals and when to recommend routine masking in hospital settings. So again, we would probably look at a similar measure to that. We're trying to determine what the cutoff points would be if we use those measures when we have 3 pathogens, COVID-19, influenza, and RSV, all circulating at the same time. But the trends we see are all very good. Slight upticks recently do make us a little worried, but we don't anticipate they're going to contribute a huge amount. And that's why I feel fairly confident in saying that we will have criteria and trends that would allow the lifting of the healthcare masking requirement over the next couple of months.
Just real quick, you mentioned March 31st. So if the emergency declaration is not extended, is it possible that OHA will nonetheless maintain masking requirement? Is that a plausible scenario?
I think that's a possible scenario, but if the conditions on the ground are such that hospitals are not needing to rely on these same measures that they're relying on right now, as the federal declaration goes away, that also removes some of the flexibility on hospitals to use spaces that aren't typically used for patient care or to enhance their amounts of telehealth. If as those measures go away and hospitals are able to care for folks that are presenting for care and trends in disease in the community are going down, I don't see any reason why we would not lift that masking requirement. We're not going to be at a place where we don't have any COVID or any flu or RSV circulating, but we should be at a place where they're circulating at a fairly low level, and our hospitals aren't constrained by the respiratory illnesses showing up, but are able to provide care without the significant waits that they are now and without some of the measures in place right now to all patients who show up for care at their doors.
Might OHA look at healthcare masking requirements as a possible recurring measure in future falls or winters?
Let me start by saying that masks are incredibly effective at preventing illnesses from these commonly circulating respiratory pathogens, and they have always been an important tool in healthcare settings when respiratory diseases are circulating at high levels to keep staff and patients safe. Certainly, I think, recommendations have been made in the Tri-County area and the Portland area for years during flu season to recommend masking in those settings. And so it's something we would consider as we move through the summer and the fall. What could our recommendations or requirements look like in the fall in healthcare settings to make sure that we keep people safe, we keep our healthcare workforce on the job, and that if we show up to get care as a patient, that we can receive safe care in an environment where masks are used to limit the transmission of this virus. But we will have that conversation as we go through the rest of the year, as we move through the seasonality of a couple of these pathogens and hope to see COVID-19 become more seasonal as well.
Thank you very much.
Thank you for the questions, and thank you for all of those answers, Dr. Sidelinger. That looks like it was our very last question, or should I say questions? And also just reminding all of you that this will be on the YouTube link on the OHA YouTube channel. So you can reference it later, as well as Dr. Sidlinger's earlier remarks at the start of this. And just an FYI for the reporters, thank you so much for putting your news agency next to your name. Those of you who were not let into the meeting were not let in because we don't recognize your media affiliation. So having that media affiliation next to your name is incredibly helpful and enables you to join the news conferences. So Dr. Sidelinger, that was our last question.
Thank you. Thank you all for coming on and helping us get the word out. I want to say the trends we're seeing are incredibly good. We're seeing decreases in respiratory disease hospitalizations and transmission across the community. Our Mpox cases are very low. And this is due to the steps that people have taken. Getting vaccinated and being up to date with COVID boosters helps to reduce transmission in the short term and keeps you safe from being hospitalized or dying from COVID-19. Having a flu shot each year is incredibly important to protect you from severe disease and to limit the spread of influenza. If you're from an at-risk group, men who have sex with men, gay, bisexual men, are members of our transgender community, and some of our members from communities of color and tribal communities, get a vaccine for Jynneos can help provide you protection and keep you protected from getting Mpox. Wearing a mask in crowded indoor settings is incredibly important if you're at risk for severe disease. And many of our Oregonians are still continuing to wear masks in these settings to protect themselves and their families and their loved ones who they return home to. So my gratitude is out there to all Oregonians who continue to take steps and to change their plans when cases go up to protect those around them who are at risk for severe disease. And I do want to thank our healthcare workers for their dedication and their continued work across 3+ years to provide the care for all of us, no matter why we show up in the emergency room or the clinic or the hospital. And my public health colleagues who continue to provide amazing responses in their community, no matter what the disease or conditions are that are in front of them. Thank you all.